Okay, so it's 11:15. I will start this off. Hi, everyone. Welcome to the second meeting of our webinar series in the Colloquium on Refugees, Migrants and Statelessness. Today's webinar is entitled Palestinian Refugees and COVID-19 Frontlines, UNRWA, the United Nations Relief and Works Agency for Palestine Refugees in the Near East. If you are participating, please mute your mics. Please also note that we are recording the webinar for those who could not be with us synchronously. The recording of last week's webinar, What the COVID-19 Pandemic Means for Refugees, with Lena Zara and Maddie Williamson, is now available online. And you can find the link to the recording on our Facebook site. And you can find the link to our Facebook site in the chat box. Today's recording will also be posted on our Facebook site as soon as possible. Let me introduce myself. I am a sociocultural anthropologist. I'm Deniz Duriz. I am a sociocultural anthropologist, and I work with migrant farm workers from the Kurdish region of Turkey and Syrian refugees in Turkey and in Europe. At Northwestern, I'm the postdoctoral fellow of the Cayman Modern Turkish Studies program, housed under Buffett Institute for Global Affairs. I'm also the creator and the host of the Cayman podcast, for which I conducted several interviews with scholars who work on migration and war with a specific focus on Turkey. So if you're interested in these issues, also feel free to check out the Cayman podcast. And finally, I am one of the co-organizers of this colloquium with my co-host Galia Ben Arya, the founder and director of the Center for Forced Migration Studies at Northwestern between 2011 and 2018, and which provided a solid foundation for this colloquium, and with our co-organizers, Danny Postel and Cindy Pingree at the Center for International and Area Studies at Northwestern. The Colloquium on Refugees, Migrants and Statelessness is one of the working groups within Northwestern Center for International and Area Studies. The Colloquium is the new generation of the Center for Forced Migration Studies and works to broaden our understanding of the realities of the refugee flows, asylum seekers, conditions of statelessness, internally displaced peoples, and development and climate-induced migration. Through this series, our hope is to raise community awareness by bringing you speakers from the front lines, advocates, practitioners, and refugees who can fill you in on their situation. The webinar series will continue throughout the spring quarter. Next week, we have scheduled a webinar on our own Chicago Golden Door Coalition. The following week, we turn our attention to Canada and the situation of refugees in Toronto. The final webinar for April will be about refugees in Brazil. For May, we have scheduled webinars about Poland, the EU policy responses, and on the work of the Refugee Solidarity Network in Turkey and Bangladesh. The format for today includes 7-minute introductions by our speakers. I will then moderate a discussion and we will open up the forum for participant questions. Before introducing our speakers and turning the Zoom mic over to them for their introductions, my co-host Galia Ben Arya will introduce herself and say a few words about how to join the chat as a participant in the Q&A.
Thank you. Thank you for the great introduction, Dennis. And as Dennis said, we're both co-hosting this webinar series, so I just wanted to briefly welcome you all to today's webinar. And I'm going to be moderating the Q&A at the end. And so if you look down at your Zoom bar at the bottom, there's chat, and you can send your questions to everyone in the chat or to me individually. And I will be keeping a running tab of the questions and then compile them. And in some cases, create distinct ones or ones that are grouped together, and we'll be posing them at the end to our speakers. So thank you. And I turn it back to you.
Thank you, Galia. Today, our speakers will talk about their crucial work at the United Nations Relief and Works Agency for Palestine Refugees in the Near East, UNRWA. which is the primary agency responsible for delivering healthcare, education, and humanitarian assistance to 5.6 million Palestine refugees living in Jordan, Syria, Lebanon, Gaza, and the West Bank, including East Jerusalem. UNRWA is on the front lines of COVID-19 response, and 3,300 health staff across 144 health clinics are implementing risk mitigation approaches in its health centers for patients who require hospitalization, as well as strengthening existing hotlines, the use of telemedicine for phone consultations, home delivery of drugs. Still, it is a race against time as UNRWA is working in conflict situations and with populations living in highly dense camp and urban environments. Our first speaker today is Elizabeth Campbell. She's the director of UNRWA's representative office in Washington, D.C. Prior to joining UNRWA, Campbell was the senior humanitarian policy advisor in the Bureau of International Organization Affairs at the Department of State, where she worked on refugee and humanitarian issues in the United Nations system. Campbell has also served as senior advocate for Refugees International, where she focused on the humanitarian crisis in East Africa and the Middle East. She was director of Refugee Council USA, an NGO consortium focused on refugee resettlement and protection. Prior to that, she worked for the UN Refugee Agency, UNHCR, in Kenya. Campbell holds a BA from St. Lawrence University and an MA and PhD in sociology from the State University of New York at Binghamton. She has published several articles and book chapters on refugee and humanitarian issues, and has served as an adjunct professor at Georgetown University's School of Law, James Madison University, and the State University of New York at Binghamton. Her work focused on humanitarian affairs, refugees, environmental issues, and inequality and social justice. Our second speaker, Gwyn Lewis, is the Director UNRWA Affairs in the West Bank. Ms. Gwyn Lewis leads all programmatic and operational components of UNRWA operations throughout the West Bank. An Irish national, Ms. Lewis has over 18 years of experience in humanitarian and development work. Prior to joining UNRWA in September 2016, she has worked with international organizations in the humanitarian and development field. Before being assigned to Jerusalem, she was the Deputy Director for Programs in UNRWA Lebanon. Prior to working in UNRWA, Ms. Lewis managed the Global Clusters Coordination Section in UNICEF's Emergency Division. She joined UNICEF from the Food and Agriculture Organization of the United Nations, FAO, in 2012, where she focused humanitarian policy and supporting FAO county offices in providing humanitarian response. Prior to that, Ms. Lewis worked with United Nations Office for Coordination of Humanitarian Affairs in Geneva Building, UN, and NGO partners supporting the rollout of the humanitarian reform agenda. Previously, Ms. Lewis worked for both OCHA and the International Committee of the Red Cross in the occupied Palestinian territory. She has also worked with the United Nations mission in Kosovo and various NGOs in Tajikistan, Afghanistan, and Albania. Ms. Lewis holds a bachelor's degree in economics and master's in international relations. So now, without further ado, I would like to turn the floor over to our speakers today, Elizabeth Campbell and Gwyn Lewis. Thank you for joining us, Elizabeth and Gwyn.
Thank you so much. We very much appreciate the opportunity to be with you. It comes at a very critical time for the agency, and in particular for the refugees that we serve. So if I may begin just to explain a little bit about UNRWA and the work that we do.
Of course, the floor is all yours.
Okay, thank you so much. So for those of you who may not be familiar, UNRWA is a UN agency. We are one of 2 UN agencies mandated to provide protection and assistance to refugees. UNHCR, with whom you may be more familiar, has a global mandate. Our mandate focuses exclusively on Palestinians. in 5 areas of operation in the Middle East. So that's the West Bank, including East Jerusalem, Gaza, Syria, Lebanon, and Jordan. We were established in the wake of the Arab-Israeli War in 1949 as a temporary entity aimed to provide basic development and humanitarian assistance until there was a long-term political solution to the crisis. Unfortunately, there has not yet been a comprehensive political solution, and so UNRWA's work has continued now for over 70 years. We basically provide 3 fundamental services. One is education. Today, our education services span all 5 areas, more than 700 schools, and we teach more than 540,000 boys and girls. So just in terms of scale and scope, if we were to put our education program and situate it in the United States, it would be the 3rd largest school system after New York and Los Angeles. So it's very significant. The second piece is healthcare, which of course is something that Gwen can speak in detail about later in terms of our COVID-19 response. And there we have, as you already mentioned, over 3,000 healthcare professionals providing primary healthcare services in 144 health clinics. And then the third piece is sort of traditional humanitarian assistance, largely in the form of food and cash assistance. And there we target the most vulnerable, no doubt, whose needs are absolutely rising in this critical moment. So with that, let me just turn to my colleague Gwen, and she can speak a little bit more about the COVID response and her field work in the West Bank.
Thank you, Elizabeth, and thank you all for being here with us and giving us the opportunity to talk about UNRWA's work. So as has already been mentioned, I manage the West Bank field. And just to give you a little bit of a sense what that means, the West Bank, there are about 830,000 Palestine refugees who live across the West Bank. About 30% of the refugees live in 19 refugee camps, and the refugee camps, as a result, are a big focus of our work. We provide education services. We have 94 schools in the West Bank, health services. We also do a lot of social services and social support work, and we do sanitation and garbage collection across the camps, and we have quite a vibrant microfinance program as well. So in many respects, for the 830,000 refugees that live in the West Bank, out of the 3 million or so people living in West Bank and East Jerusalem, we are quasi-governmental in terms of the services that we provide. So there's quite a heavy reliance from the refugee population and on the day-to-day services. So that is within the context, as you know, of ongoing tensions between Israel and the West Bank. There are quite a few incursions. Last year we had about 6,000 Israeli security force incursions into the West Bank, so there's a lot of protection concerns and issues. So that's just to give you a little bit of the backdrop of what happened at the end of February when we had the first announced COVID-19 cases in the West Bank. Since February,
I think we're having trouble with Gwen's internet connection. Elizabeth, could you take over for now?
Sure, absolutely. So Gwen will come back and provide the kind of detailed analysis that she's most familiar with from a field perspective, but if I can just respond a little bit to the agency-wide perspective. So as Gwen was denoting, because there has not been a political solution for Palestine refugees, in many ways, we've become the development arm of the refugee community, and they rely on us and look to us, especially during moments of conflict or extreme crisis like we are now all facing with the pandemic, to provide a response. So just speaking sort of broadly in the region in terms of our COVID response, again, we are on the front line. So we have issued an emergency appeal of around $14 million to supplement the ongoing work that we're doing. And that money helps to equip both our healthcare workers as well as the clinics with the necessary protective equipment that they need to be able to triage different patients who are coming in on a daily basis, to quarantine those who may appear to have the COVID symptoms, and to keep others healthy and safe. We've been very innovative in terms of developing telemedicine and other ways of engaging in a healthcare response to ensure the safety of everyone. And in addition, again, at sort of a regional level, we had to also immediately implement one of our most innovative projects, which is emergency in education. Or rather, education in emergencies. And this is sadly something that we've developed over the past several years as a result of ongoing conflict, namely in Gaza, 3 wars, but also during the conflict in Syria. So this provides resources to our students and to our families to be able to continue their learning in their homes. And we do this through a myriad of ways that includes satellite television, online opportunities, but also we're very cognizant of the fact that especially our most vulnerable families don't have access to multiple computers or online devices. In that case, we are literally going door to door to distribute materials to ensure that our students have access to education. And then maybe on the humanitarian front, here is an area that we absolutely know is going to need our focus and attention in the coming days, weeks, and months. As everyone knows, as part of the way to combat this global pandemic, we are all asked to engage in social distancing guidelines, but also largely to stay at home. And this, of course, is the case across the Middle East, where we have COVID cases in every area of our operation. Now, for those of us sitting here in Washington, D.C. or in Chicago, this may be an inconvenience, but perhaps something that many of us can easily find coping mechanisms to address. For many, many, many of the refugees that we work with, this can be an intolerable situation because it means stripping these individuals of their livelihoods. Many of them depend on daily wages to purchase food for their families. So if UNRWA is not able to find ways to increase our food and cash assistance to these vulnerable families, we're very deeply concerned about what this may mean for millions of people in the coming weeks. Is Gwen back online?
Yes, she's back on. Can you hear us, Gwen?
Yeah, apologies for that. I don't know what happened. It just dropped.
Right. Go ahead, please.
So, I caught a little bit of what Elizabeth was saying. So what really happened at the end of February was this, as like everywhere else in the world, these new COVID cases and a very strong reaction from the Palestinian Authority. And so the first thing that happened was we closed all of our schools, and as Elizabeth has already mentioned, have begun to provide remote learning materials and learning support to the students. So that has been a very significant activity, but more importantly has been this real pivot towards health response. So our 43 health centres across the West Bank now are involved in triaging patients that come to refer potential COVID cases to the Ministry of Health. We've had to purchase and supply all of our workers with PPE equipment, including our sanitation labourers who are now very involved in disinfection and sanitation and cleaning camps and health centres to really make sure that hygiene standards are as high as possible. And so there's been a huge effort to try and work with the communities in terms of information sharing, to ensure that people who are asked to go under quarantine stay under quarantine, that people are respecting social distancing and all of the other measures that have been recommended. So what we have seen over the past weeks is a relative control over the numbers in the West Bank. There's about 250 cases at the moment confirmed. In Gaza, which is the other field with, that we are working in Palestine, there's 13 cases, but obviously huge concerns in Gaza if there was further cases and further spread, just given the density of the population, the very under-resourced health system, and so it could be potentially catastrophic in Gaza. So there's been huge efforts and very sustained efforts to do as much prevention work as possible, because there isn't the number of ICU beds that would be needed if things got dramatically worse. So the only option right now is prevention. One of the big challenges this last couple of weeks is the fact that many Palestinians work in Israel. So there's an estimated 50,000 Palestinians currently working in Israel. One of the challenges is that they're coming back from Israel across checkpoints through the barrier that's in place, and they're not being screened correctly. And now we've seen, because of their gradual return, quite a broad spread. So it's not very significant in terms of numbers, but for the first time, the initial outbreak was in Bethlehem, and for the first time now we're seeing cases across the West Bank, and it's getting much more difficult to control. So there's a lot of focus right now on testing, quarantine centers, and obviously one of the big challenges, as you can imagine, living in a refugee camp, is the lack of space. So many families, there could be, the average is about 3 people per room. So you can imagine families with high number of children or living with elderly relatives. When a worker comes back from Israel after being a carer in an Israeli institution or working in a factory, they can't be home isolated. So there's a huge pressure right now to find alternatives for quarantine for some of these people who can't keep the distance from their family if they do return home. So that's a bit the concern, and where we see things escalating. Just to give you a little bit of a perspective, there's 250 cases, as I mentioned, in the West Bank, but in Israel there's more than 9,000, and so there's significantly more risk of being in contact with a case in Israel, and there's fears that it will spread into West Bank or Gaza if we're not able to contain it. So this I think, just to this introduction, what this really shows is the importance of the backbone of the health services that we provide across the region. So we have a similar situation in Lebanon, a similar situation in Syria, and the important role of UNRWA, the investment of UNRWA over the past 70 years in terms of our education and our health services mean that we're ready to respond, and we're able to support the communities in this very difficult situation. And the pressure on our funding means that if we are not able to sustain funding to our schools and to our health centres, this will all collapse. And so it's not just a need for funding for the corona response, but it's also a need for funding to really sustain these primary healthcare systems and education systems across the region. Maybe I'll stop there, because I think I've spoken a little bit, and I know the timing is tight.
Elizabeth, would you like to add to what Gwyn said, or would you like me to switch to the questions?
We can go ahead and get to the questions, and I'm happy to elaborate at that time.
Okay, so thank you for your introductions into the overall situation. And you have both outlined the crucial practical role and the know-how that UNRWA has in terms of health clinics, health services, provision of PPOs, and the know-how in general in terms of how to navigate curfew situations. As you also mentioned, being trapped at home is not new to Palestinian refugees or in the camp. So could you tell us more about your financial situation and how the US funding cuts impacting UNRWA's ability to respond to COVID-19?
Sure. Well, thanks a lot for that question. Look, as Gwen said, Over 7 decades, UNRWA has developed this extraordinary capacity that allows us to actually be highly effective at moments of regional and global crisis. And a lot of that capacity was through the generous support of the United States, which was a founding government, which is a founding member, if you will, or was really the driving force behind the creation of UNRWA. And for all of those years provided us with generous financial and political support. That came to an end unexpectedly in early January 2018. And since that time, over the last 3 years, really, we haven't received any funding from the United States. And this has absolutely adversely impacted our ability to deliver on our mandate, which is broadly supported by the majority of the UN member states, and has compounded our challenges at this precise moment. The United States, in its own words, basically stopped funding the agency, not because of anything that we were doing, but because of their own political agenda with the Palestinian Authority, which is completely separate and different from the work that we do. And what we have seen as a result, basically, is a policy that continues to this day that is adversely impacting men, women, children, and families who really depend on us in these moments of crisis. So the funding cuts, in short, have had a corrosive impact on the institution as a whole and are absolutely impairing our ability to scale up to the degree that I think we, and especially my colleagues like Gwyn, who are on the front lines, on the ground, in the field, would like to see. So we continue to lament the loss of this partnership, and we are very, very worried about what this means for us moving forward this year, but especially at this moment. As you may know, I'm sure as you do know, the United States Congress just passed a $2 trillion spending bill. Included in that bill was significant funding for foreign affairs, including humanitarian assistance, which is generous and correct, because I think we can all agree that the United States cannot recover from this pandemic unless the entirety of the world recovers simultaneously. So that foreign assistance and humanitarian assistance is important. What's very regrettable is that until today, none of that assistance will be provided to us in our work to combat COVID-19 or to Palestinians generally. And that is extremely unfortunate and absolutely impacting our ability to be as effective as we would like to.
Thank you for that response, Elizabeth. Gwyn, would you like to comment on the financial situation and how it impacts your work on the ground? Sure.
I think what has been very difficult this year is just the fact that we're going month to month. We're an organization with about 30,000 staff, most of whom are teachers, doctors, sanitation laborers, really people who are delivering services to communities. And so managing a budget of that scale from month to month is extraordinarily challenging, and it also creates a lot of anxiety, as you can imagine, for our staff, but also for the communities we work in. Children, when I go to visit schools, often ask, will our school be open next month? Are you going to close down? Because they know of the financial challenges that the organization faces and this very political attack on the organization. Just to give you a sense, up until last week, we didn't know if we would have funding for May. This week, we have managed to scrape together enough money to be able to pay salaries for May. But for June, we really don't know, and we may have to borrow funds from the SURF, which is the pool fund at global level the UN manages, in order to pay salaries in May. And given we're in the middle of a health crisis, and a lot of the work that we are doing is sustaining doctors and nurses on the front lines of this fight, and that type of worry about whether or not we'll be able to just sustain our basic services, never mind raise the additional funding needed for PPE, for the additional health staff that we need. It really is very, very challenging.
Thank you. I will just ask one more question before I open the floor up to questions for the Q&A. I want to, it seems like a terrible and dire situation. I know that it can't be, of course, compensated with individual donations, or this damage cannot be reversed with individual efforts. But what can Americans do to support UNRWA?
Sure, no, it's a great question, and it's important that Americans pay close attention to this issue because this is a solvable problem, right? It does not require a special law from Congress to be passed. It doesn't require an extra political effort. It just requires a policy shift and for the United States to resume its historic partnership with the agency. And I have the highest confidence in my colleagues, and they'll be able to respond very quickly with those additional resources. But I would like to draw everyone's attention to our sort of sister organization, UNRWA USA. You can find them at unrwausa.org. And they're the private giving arm of the agency. They work to increase the sort of profile of the work that we do, and also to secure private donations for the agency. So if you visit their website, you can see there the different types of activities that they're engaged in, including various advocacy work and call to action that they ask their members and supporters to engage in. So that's a really great resource, especially for Americans who are looking for ways to contribute, both in terms of advocacy and potentially also financially.
Okay, thank you. So I think we are ready to open up the floor for Q&A. I will turn over moderation to Galia.
Hi, thank you. And thank you for those presentations. So we have a number of questions. The first question that I'm going to use my role as a moderator to ask, though, is, you know, different countries, like in the United States, we've had state, you know, local governments, we've had the state level government, and then at the national government, you know, set the policies, you know, change the policies in response to COVID. What happens in East Jerusalem and Gaza? You know, who's been setting the policies? How do they get set? And then how is it changed in response to COVID?
I'll take that, Elizabeth, maybe. So thank you for the question. I think it differs slightly in Gaza from West Bank and East Jerusalem. So in Gaza, the de facto authorities, Hamas, are responsible for the Gaza Strip. But because of the sheer size of UNRWA, because there's out of the 2 million people living in Gaza, 1.4 million are refugees. So UNRWA has quite a significant footprint. So when it was realized that there were some COVID cases, the director of UNRWA there decided to close down the schools, even though the other schools managed by the de facto authorities hadn't been closed yet. And because he did so, and they then decided to close down the other schools in Gaza, the public schools. So UNRWA in Gaza has quite a lot of influence on the response, and the position has been very much, even though we don't have many cases in Gaza, let's act like there are cases already in Gaza in order to prevent the spread and in order to not find ourselves in a situation that we're just not able to manage. Just to give you a sense, there's 85 ICU beds with ventilators in Gaza with a population of 2 million people. So just scaling up in terms of capacity and expertise to deal with a crisis like Corona is just unmanageable in a short space of time. In the West Bank, it's very much led by the Palestinian Authority. And that includes East Jerusalem. However, certain parts of East Jerusalem, the Palestinian Authority is really unable to work in because of some of the restrictions that Israel has put in place. So just to give you an example, East Jerusalem is serviced by the municipality of East Jerusalem, and they provide healthcare services and education services, although at a much lower standard than the services provided in West Jerusalem. When the Palestinian Authority tries to build a school or provide services in East Jerusalem, they're very often challenged, and Israel has closed down 10 schools in East Jerusalem this year that are managed by the the Palestinian Authority or that are teaching the Palestinian Authority curricula. So it really is challenging in East Jerusalem. So there we have a dual system where UNRWA has certain services that we provide. We have several schools in East Jerusalem and we have 2 health centers. So we're providing services to the refugee community. There are some Waqf schools, there are some Israeli municipality schools. So the efforts in terms of the response to Corona have been multiple, and for the first time in quite a while, the coordination and the cooperation around the response has been positive. In the West Bank, the response is really led by the Palestinian Authority that have very much the leadership in all across the West Bank, including parts of East Jerusalem where they're able to have reach. And they were, the Prime Minister was very forward-leaning in terms of taking measures. And we work under the guidance of the Ministry of Health. So we refer cases, suspect cases, to the Ministry of Health, who leads on the testing and the follow-up and hospitalization as needed.
Thank you. So one of the questions from the audience, connecting it to what we were just talking about, is thinking about what's going to happen, you know, if there's a big outbreak. What are kind of the sustainability structures that might be in place? The specific question was whether there are any agricultural sustainability structures in place in the different camps for food security in case aid gets cut more, you know, or somehow food supplies aren't coming in.
It's a good question, and I think very often, particularly in the camps, the issue is just the sheer density and the population density. So there's very little agricultural land. The refugee camps were set up following displacement of people, obviously. So they lost their land, they lost their homes, and so have established in informal settlements that have turned into urban areas, and most of them very densely populated urban areas. So agriculture is quite a challenge. There have been some initiatives in terms of roof gardens and trying to create small-scale agricultural inputs, but it's very limited and really isn't something that will compensate for economic activity or work or other forms of food security or assistance. So there has been various attempts. It's a lot more difficult in Gaza just because of the lack of space and the sheer number of people. But because we're not only seeing a health crisis, what we're also seeing is people losing their jobs. People who had informal work no longer able to work, lack of movement between cities. So even in the space of 4 and 5 weeks, people are really feeling the economic impact, and we're already getting a lot of requests from families for food assistance because they've been in quarantine or under curfew for a month, and they just don't have any income and they live from day to day. So this is going to be the big challenge coming up, and the Palestinian Authority is already anticipating billions of dollars of losses over the next few weeks.
Is there any discussion now? It sounds like similar, you know, with the economic issues, a lot is changing rapidly. And one of the questions is thinking, you know, beyond pandemic times, is there any systemic changes that might be, you know, coming as a result of this? You know, does UNRWA maybe now, is there maybe going to be a pivot on a long-term contingency plan about how to achieve financial assistance for Palestine? You know, is there any kind of, I know in this there's the negative, but do you see any hope for anything positive that might be arising in terms of setting up any lasting structures that could exist without US funding?
Well, I mean, since the US funding has been cut, there has been a lot of solidarity from other countries to support UNRWA. I suppose what this crisis has again demonstrated is that the importance of having those basic services and those structures there for the communities, and if they weren't there, the situation would be a lot more dramatic. But also, if funding isn't continued, we could be facing instability in the region. It's 500,000 children out of school. Will have an impact, and the lack of health system for refugees will also have an impact. So it's very important to continue to advocate in that direction. I'm not convinced that there will be a positive pivot, in the sense that I don't anticipate that donor countries after this type of crisis will have more funding available. We're also facing oil crisis in terms of prices. So the world is not going to get richer in the next few months with dealing with this health crisis internationally. So the concern is that the sustainable funding and the discussion around sustainable funding will become even more challenging than before. So sorry, I'm not trying to. For right now, the light at the end of the tunnel is the headlamp on the oncoming train, and we're really worried about what's going to happen in the future in terms of the long-term financial sustainability of the organization.
So a correlated question is, what would you want to see from Israel that might lessen this impact of the pandemic right now?
I mean, what we have seen, and I think to be positive, and I think that is something that we've seen that is extraordinarily positive. We've seen Israel and the Palestinian Authority, even in Hamas, also identifying this as a common concern and something that everybody wants to work on together, the COVID response. And there has been coordination around supplying test equipment to Gaza and to the West Bank, ensuring that PPE materials are getting through checkpoints, so that in that sense the coordination has been positive. I think in terms of what Israel can do, I think that the Israeli security forces are on the phone with me on a daily basis, concerned about our contingency stocks, concerned about the food needs in the camps, and why can't UNRWA do more? I think the Israeli authorities do have a responsibility to engage with the US administration and say this organization continues to be needed, and particularly in Gaza, without UNRWA, there are no alternatives for the 280,000 children who will no longer be able to school, other than the de facto authorities in Gaza, which are Hamas. So there is a responsibility on the Israeli authorities to either step up and provide the financial support, or to lobby so that other countries will.
Okay. Are there any, one of the participants asked, they said that, oh, there's a number of large organizations and celebrities, pharma companies making large donations to humanitarian organizations in the US and worldwide. Are you seeing some of these donations going to UNRWA too? And if not, why do you think that is?
So, I think that, yeah, sure. I mean, we do engage in private sector fundraising. I mentioned, of course, our sister organization, our national committee that does it here in the US, and we do receive some donations, but not at the same scale as other sort of global UN agencies. So in some ways that's normal, because we have a regional mandate. But the other piece I would add is that it's difficult for us to fundraise in a political environment where the work that we do is attacked politically on a regular basis. It makes it very difficult for donors to understand the reality on the ground when you have not just sort of small niche organizations, but very powerful governments and powerful officials in governments making really, frankly, what are often baseless claims. So that, I think, really does play into our ability to be more effective. But having said that, there are many partners that absolutely support the work that we do, and they are supportive during this period as well.
Okay, thank you. Turning our attention back to the front lines and what's going on for people on the ground, women's groups across the MENA region, including different areas where UNRWA operates, have been talking about an uptick in domestic violence reports as a result of the COVID-19 quarantine. Have you seen any of these issues playing out among UNRWA beneficiaries on the ground, and have you been able to provide any assistance in this area, and if so, in what ways?
So the increase in domestic violence cases is a global concern, because when we have restrictions on movement or quarantine or curfew, we are across the world seeing an uptick in domestic violence. And excuse me, it's no different in the West Bank or Gaza or in the camps. So we have been very, very aware of this phenomena, and we have refocused the work of our social workers on hotline services and outreach to vulnerable families. So some of our social workers spend a lot of their days now calling families that we were either providing assistance to before because they were vulnerable or who had faced protection concerns before. And then we are also manning a hotline, so people who have concerns, whether they're anxious about the situation, whether they're having issues maintaining their kids at home and supporting their children with their schoolwork, or whether they are facing more serious issues like domestic violence, there's a social worker who can help. We also work very closely with the Ministry of Social Development to follow up on cases. So we are seeing issues, and we're trying to follow up. Movement restrictions obviously hamper some of those efforts, but we have been able to help some families, and will continue to do so. That's one of the advantages of UNRWA is the fact that our staff are members of the community. So when we have a crisis like this, they're already embedded and working in the communities and can respond and can reach out to families who are in a difficult situation to try and support them as best as we can.
Yeah, thank you. What does it look like on the ground, you know, when people are trying to navigate the need to social distance? I mean, I know what it looks like in my community with people still congregating on beaches, and I know we saw a little bit of news about Gaza, people out, you know, on the beach. What does it look like? Is it an impossible ask, you know, to ask people to actually be socially distant? And so what does it look like for families? Like, what are people doing day to day?
It is quite a challenge, just because of the lack of space. And I think initially it was very, very difficult for people, but because the level of anxiety now is so high, because people are beginning to understand the implications of what could happen if the virus spread further, people are really making a lot of effort. So awareness has been really important, and we're lucky because before the schools were closed, we had a couple of weeks where we did a lot of work with the students around washing hands and what does it mean to keep separate, and how you can protect yourself and what you need to do at home. And so we were able to do a lot of that work with the kids, and obviously they're our ambassadors at home, and so that was, I think, very helpful, and we continue to do that. We have a Facebook page, we do a lot of social media work, and we're distributing materials to families who don't have internet, and so flyers and different information materials, hand sanitizers. So it's trying to create awareness, and even though it's not easy, just taking certain measures at home and cleaning down surfaces and more regular pickup of garbage, for example, it really just helps families just take those extra precautions to protect themselves. But it's not easy, and it really is changing behavior and trying to change behavior in a very, very short amount of time.
We had one final question from the participants, and then I also want to just ask one final question. So final question for the participants is, what kind of assistance or considerations do you have for people who have disabilities? You know, because there would be an additional challenge. And then I'll add, so you could address that.
Sure. I mean, it's the same. We had a team also working on supporting people with disabilities, but also our education program is very much centered around inclusiveness. So we've made a lot of effort to ensure that disabled children are able to be integrated into the classroom. So both in terms of the education program as well as the social work program, we're following up with families and providing extra materials if needed, talking through with parents how they can best support their children, and then just providing supplies where we can. One of the big challenges coming up is really this economic issue I think I mentioned before in terms of food assistance and cash assistance. And that's one of the big asks from families with people with disabilities, additional support for food and cash assistance, just to make sure that they're able to support their family members. So this is one of the big requirements we have with our appeal and our funding challenges. But again, our social workers are following up with the families and doing what we can with the resources that we have.
Thank you. Okay, and then the final one would just be, can you share with everyone a link for what's the best way people could keep abreast of the situation, get information? If you could, share some links, that would be terrific.
Yeah, we can do that. We have our website where we have our SIP reps now on the corona response that are available, so we can absolutely share that after the meeting.
Okay, I see one more question, and we do have a little bit of time here. And it was on my mind too. You mentioned that you have your healthcare centers, but what about cases where Palestinians have to get medical attention at the main hospitals in Israel? How is that right now? Like, is there people who have cancer and they need treatment? Like, what kind of treatment do people actually have to go to a bigger hospital system? Do they go into Israel, and then during COVID, like, how is that working?
So the main hospitals, the specialist hospitals there are several specialist hospitals inside the West Bank, but the main specialist hospital, particularly for cancer and palliative care, are in East Jerusalem. And so people have had to travel to East Jerusalem and stay, whereas before they could go for the day and come back. But because of the movement restrictions and the concerns, many people have had to actually stay in the cancer ward and sleep there, for several weeks, because of the risk to their health, but also the movement risk. So that has created an additional cost, obviously, to the hospitals, and they're the same hospitals that would be asked to treat patients with COVID-19. So this is one of the challenges that the community is facing. Up until now, it's been manageable, although the East Jerusalem hospitals are also not receiving funding, and they were that was one of the programs that was also cut by the US administration. So they still haven't really been able to recover in terms of support. So there's been a big push and effort this week to flag requirements, and we're trying to work with donors to get additional support for the hospitals. But they have also put out just tents at the front of the hospitals to act as triage centres for the eventual increase in patients. So that's also, all of these contingency measures are being put in place. But as I said, the normal delays through checkpoints for the West Bank have been reduced significantly because we've seen more cooperation with the Israeli security forces. But that's not necessarily the case with people coming from Gaza. There are still delays and restrictions and concerns about people leaving Gaza because of this crisis.
Thank you. It's a very stressful situation, and I personally want to thank you for being there, and UNRWA. And I'll turn it back over to Dennis.
Thank you.
Thank you.
Okay, so this is all the time we have for Q&A today and for today's webinar. I would like to thank our speakers for this insightful conversation and for updating us on the situation situation of Palestinian refugees and the challenges that UNRWA is facing. I'd like to thank our participants also for their wonderful questions that made this conversation possible. So Elizabeth and Gwen, do you have any final words before we close the webinar?
No, thank you very much. I've provided the websites for both UNRWA and UNRWA USA, but please, if anyone has additional questions or wants more information, never hesitate to be in contact with me. I'm very happy to be available. Thank you so much for having us.
Okay, so thank you again, Elizabeth and Gwen. Please keep following us on our Facebook site. The link is shared on the chat box. Next week, we have a scheduled webinar again on Wednesday at 11:15. And we will be speaking with Chicago Golden Door Coalition. And this is it for today. Thank you for joining.
Thank you.
Have a wonderful day, everyone.